Hi, my name is Callie. I'm going to be your nurse today, okay? Could I please get your name and your date of birth? Okay, so then I would confirm that, make sure this is the right patient. I've already checked your order, okay? So I'm going to be inserting an NG tube for you today, okay? I'm just going to go ahead and put my PPE on, okay? Just to protect myself, and then I'll do a little bit of inspecting to get you ready. Okay, so I'm going to put on my gown. Maybe. Okay. I would put a mask on as well, but I don't have a mask. So I'm gonna pretend that I have a mask on. And then I'd get my goggles on. And my gloves. All right. Do you have any allergies that I need to be aware of? No? Okay. Perfect. So what I'm gonna do is I'm just gonna look up your nasal cavities, okay? I'm just gonna see what they look like, if they're clear or not. All right. Now what I'm gonna have you do is I'm gonna plug one of your nostrils and have you breathe. We're just gonna figure out which nostril you can breathe better out of, okay? I'll plug this nostril. Breathe for me. Perfect. Breathe for me. Which nostril do you think you could breathe better out of? Your left nostril. Okay, perfect. So that's the nostril that we're gonna be using, okay? I'm just gonna check your gag reflex really quick. Okay, you gagged, perfect. All right. So now what I'm gonna do, I already have my tape ready, set out here for me, okay? I have my pH strip, I have my piston, alcohol wipe, my SaO2, lubricant, NG tube, pad, water, perfect. All right. So now what I'm gonna do, I'm just gonna listen to your lungs and your stomach really quick. I'm just gonna get a baseline for myself. Okay, I'm gonna pull this down a little bit. Okay, perfect. All right, I'm just gonna go ahead, I'm gonna get this SaO2 on you. I'm gonna be checking your saturation throughout the process. I'm also gonna give you this cup of water, okay? I'll tell you when, but I'm gonna have you take some drinks of water, and as you're swallowing it, I'm gonna be pushing the tube. It's just gonna help the tube go down, okay? All right, also, I'll get your hand out over here, okay? If you, at any point you wanna stop, just squeeze my arm, okay? All right. I'm gonna go ahead, I'm gonna just measure my tube and see how far I need to insert it, okay? Perfect. I'll tape that. All right, now the tube is taped, perfect. I'm gonna put this pad on you, okay? This is so if you vomit, we just don't want it getting all over you or your bed. I'm also gonna give you this basin, something to vomit into instead of your lap. All right, next I have my yanker, okay? This is hooked up to suction. So if you vomit, then I can put this in your mouth and I can help you suction some of that vomit out. Okay, got my lubricant. I'm gonna put some of my lubricant in here. Perfect. All right. I'm gonna go ahead and attach my piston to this. All right, I'll set that in there. Okay. Now what I'm gonna do is I'm just gonna get this all lubed up, all right? And then we're gonna get going. Okay. Going in your left nostril. Okay, ready? I need you to hold your head still for me. Ready? 1, 2, 3. We're inserting. Perfect. Okay, now I'm gonna have you put your chin all the way down to your chest. I'll hold the back of your head. Okay, get your cup of water for me. Can you take a drink of water? As she's drinking, I'm pushing, okay? Take another drink of water for me. Perfect. Go ahead, take another drink. Okay. Keep drinking your water. Keep drinking. We're almost there. It's kind of hard to insert on this. Okay. Alright, we're going to pretend that I made it all the way down to my mark. Obviously, this is a mannequin. It's not going to go down to my mark. So now what I'm going to do is I'm just going to take some of your contents out, okay? I'm just going to check it on that pH strip. Okay. It says your pH is a 3, which is perfect. We want that below a 4. I'm going to go ahead and just tape this to your nose, okay? Just so that's not moving around. Just get this wrapped around. Okay, wrap this side around. Okay, another thing I want to do is I want to make sure that my mark is still visible with this tape wrapped around. If it's not, I could grab a Sharpie or something to mark it. Just make sure that it's still visible. Okay, I can disconnect this from suction, okay? I'm gonna just check your sounds again. I'm gonna listen to your lungs and your stomach one more time. Okay, listen to your stomach. Alright. Perfect, sound good. Alright, and then if ordered, we would get radiology to get an x-ray. Make sure that this is actually in her stomach, okay? If ordered, I could connect this to suction if that's what this is being inserted for. Okay. So then when I'm done, I would document which type and size of tube I used. I would document which nasal I inserted the tube. I would document the patient's response to the tube. I could document the integrity of the nose just in case like the adhesive is messing with their nose. We don't want that to happen. And then the time that I documented, or the time that I inserted it. And then for removal, I would, if it's connected to suction, then I would turn the suction off, disconnect it, and then I would get my piston again. I would get 30 to 50 milliliters of air, and then I would connect it here. I just push that through. Perfect. This is just to clear out that tube. Okay, now that my tube is clear, I could go ahead, I can get my tape off. Okay, my tape is off. Okay, so now I'm gonna remove this tube for you, okay? I need you to bear down, ready? 1, 2, 3, pull, 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 pull. Just pile all that in here. Alright, and then we can dispose of that properly. Then if needed to, I would wipe her up, clean her, anything that she needed. Okay, and then for documentation of that, I would just document that I removed the tube, how the patient tolerated it. I would document this disposal of the tube, and then again, if she was connected to the suction, I would document like how much contents were in it and like the characteristics of it. And that is it. Thank you so much. You did wonderful. Have a good day.